Now, from the News Channel 5 network, this is Medical Mondays.
Welcome to Medical Monday. I'm Carrie Sharp. So glad you're joining us tonight. We have an important topic to bring you. We're going to be talking about lung and esophageal advances, and specifically lung and cancer of the esophagus. I have Dr. Ninan here with me with the Nashville Lung Surgery Center. Thank you for being here.
Thank you.
You know, this is a very important topic because when we talk about lung cancer, we talk about esophagus cancer. They're very deadly, and often they're caught late in stages, and so getting to the patients quicker is so important so they can start treatment. And I know this is a goal for you, which means you're trying to change up how the normal practice goes and normal procedures goes. Can you tell me what you're doing?
So what's generally happened in the past has been that what we found is that when patients present to us with their first symptom of some of these deadlier cancers, it takes a long time for them to work through their whole investigative process to actually get to a stage where somebody can treat them. And so some of it is good in that they do the right things, but it actually takes them a long time. And if you look at a lot of our patients, you find that it's been 2-3 months since they've had their first symptom before they come to us. And so on the one hand, what we want to do is we want to reduce that time. That is the time that they present to their doctor with their first symptom, or it's found on an X-ray or a scan or whatever, and the time that they get to the first day of their definitive treatment. And you can basically break it up into two things. One is that you can take it from the time that they present first to the time that they come to their specialist, the first day that they actually see the specialist. And the second thing you can do is from the day that they see their specialist to the day that they get their first treatment. And so both of these we want to reduce. The first more than the second, because usually once you get to the specialist, you know, things tend to work quickly. The second thing that we find in a lot of the southern United States is that cancers of the lung, when we talk about that, it essentially affects people in rural communities a lot more than urban communities. And so if you look at the rates of smoking, which we know is one of the prime causes of lung cancer, we find that we have county by county percentages of the population that smoke. And when you look at our rural counties, you know, it's getting to 25-30% of the population agree that they smoke, that it actually may be more. But then if you look at the national average, it's about 15 to 17%. So in some counties, it is 10% more than the national average, or even double. So we want to focus on areas that are, you know, have the highest incidence of this. So it is up to us specialists to get out there into the community, work with the great doctors who are working in our rural communities. And I must say that many of the doctors in rural communities sometimes have difficulty in getting the patients to the specialist, and that can happen to a variety of reasons. One is that the patients find it difficult to travel.
They just don't have the means sometimes to do it, or the transportation to do it.
Exactly, and they're elderly, and you know, they have to depend on relatives and all that kind of thing. The second is that they you know, we are all busy, and it takes weeks sometimes to get in to see the specialist. And so all this kind of begins to add up. And the one thing that we know from cancers of the lung or esophagus and other chest cancers is that the earlier we treat it, the better patients do. And you could, you know, some people say, yes, many of these patients are elderly. Why do we need to find it early? How do we know that we actually extend their lives? There is actually a lot of data that tells us that we do extend their lives. And what we want to do is to reduce the total mortality, that's the total deaths from cancer as a country.
Without a doubt. Everyone can understand that goal.
Yes.
We want people to live. We want people to live a good life.
Exactly.
And cancer needs to be taken out of that equation. I want to take a quick pause here and remind you, this is your chance to call, get some free help, get some free advice. Dr. Ninan is the expert when it comes to lung cancer, to esophageal cancer. So the number is on the screen. 615-737-PLUS is the number to call. That's 7587. We'll get those calls lined up, and we'll take your questions tonight. We've got an hour to do so. So go ahead and get on the line, and we will get to as many calls as we can. Let's zero in on lung cancer now. I told you I have a grandmother and an aunt who both died from lung cancer. It's a painful, terrible disease, and you said almost everybody knows somebody, has a relative, has a friend who has died from lung cancer. And so many times it goes back to smoking, doesn't it?
Yes. And the issue with lung cancer is that lung cancer is by far the biggest cancer killer that we have in this country. And it is the major cause of cancer mortality in men, in women. In women, we hear a lot about breast cancer, and there have been amazing advances in breast cancer. But lung cancer actually kills a lot more women than breast cancer. And so what we want to do is to try and reduce the mortality in this age group. And we want to see that they get to a specialist sooner. And this is what we've been working towards recently.
I know obviously smoking, #1 risk factor.
Yes.
But non-smokers can get lung cancer too. How prevalent is that? Or people who have quit smoking a long time ago?
So we know very well that the incidence of lung cancer falls off quite sharply in people who have quit smoking for a few months. You know,
wow,
it slowly
really?
starts to decrease. Within a few years, they can reach a plateau, but that plateau is always higher than those people who've never smoked a cigarette. In fact, the latest research has shown that if you've smoked approximately 100 cigarettes in your life, you already have changes in the cells of your lung that put you at risk for cancer anytime in your life. So even people that have quit smoking, they do have a higher risk of lung cancer. And nowadays we see a lot of people that have quit smoking when they were 20, 30 years old, and now they're in their 50s and 60s, or even 60s and 70s, and they do have an incidence of lung cancer. So that's one issue. The second issue was between smokers and non-smokers. Despite all our efforts that the country has done over the last, to 30 years to reduce the incidence of smoking, we still believe that about a quarter of our population still continues to smoke. So the incidence of lung cancer, that means the number of new cases of lung cancer that we see in this country every year, is approximately 200,000 in that range. And about 200,000 people actually die from lung cancer every year. So it's not the same people, but some, that's what we're looking at. So what we've shown in lung cancer is that, about 80% of patients who get lung cancer are smokers at some time in their lives. The more you smoke into an older age group, the higher the risk. If you are smoking when you're in your late 50s, 60s, and 70s, the incidence of lung cancer is extremely high in that group. So those are the patients that we need to focus on. So when you have relatives and others that have been smoking into an older age, then those are the patients that you need to get checked up by your doctor, get some x-rays, or even get a scan. Because their incidence is very high. And the earlier we find it in those patients, the better treatment that we can give. About 15 to 20% of lung cancers occur in patients that have never smoked in their lives.
Really?
And we know that those patients can not even have a history of secondhand smoking. And those kind of cancers are slightly different from the standard types that we see. But when you see something that patient who has never smoked in their life have the symptoms of lung cancer, that is a cough, spitting up some blood, finding something on an x-ray that everybody says, oh, this person has never smoked, it's okay. Those are the things you need to take seriously.
Okay, let's take a pause and take a phone call. Robin is on the line. Robin, thank you for being part of Medical Monday today. What's your question?
Yes, ma'am. I was a hypothyroid and I had thyroid surgery a few years ago. And recently, I have been having problems with food going down my throat, choking on it, and even drinking water. My primary has been dealing with it, and I also have a family history of lung cancer. So I'm wondering if I should go ahead and have a thyroid doctor look at my throat.
Okay. Thoughts,
Robin, how old are you?
I'm 59.
59. And when you eat, you feel that food and water are sticking in your chest or in your throat?
It feels like it's rubbing up against something in my throat.
Okay. So generally swallowing problems, thyroid surgery usually does not cause swallowing problems. So if you have a problem with getting food down, and this is a new symptom in somebody who's of your age group, I would say that that is a symptom that should be taken quite seriously. One thing your doctor might do is to refer you to a gastroenterologist who's able to look down your esophagus and make sure that there's nothing obstructing it. And if this persists, I would recommend that you talk to your primary care doctor about doing something like that.
Yeah, I do have a gastro doctor. I just had my colonoscopy. Next week I'm supposed to do the camera down the throat.
Okay, good. So I think that should clarify a lot of things. Food sticking can be due to muscular problems of the esophagus. It can be due to tumors of the esophagus. There can be a lot of reasons, and your gastroenterologist should be able to clear that up after doing the scope for you.
Robin, good luck to you. Thank you for calling in tonight. I hope that you can find a remedy to this problem. She's mentioned that she's going to the gastroenterologist, speaking about going to a thyroid doctor. How do you know which specialist is right when you start to have symptoms that either deal with the esophagus or your lungs, or you're just not exactly sure what the problem is?
So essentially, the symptoms that we find in esophageal patients is very different from symptoms that we find in lung patients. So esophageal cancer is a condition that is increasing in incidence. And we really don't know why, but we think that it is related to being overweight. We think it's being related to the more incidence of gastroesophageal reflux, that is heartburn, etc. And so those patients essentially, in the very early stages, they usually do not have symptoms. So if you've had chronic heartburn, that is, it's been going on for many years, etc., you could have a condition called Barrett's esophagus, which is a change in the lining of your esophagus due to the acid. And those kind of patients may need a referral to a gastroenterologist so that he can place a scope down, do some biopsies, see what you have, do you have early stage cancer, etc. The others are those that present with swallowing problems. So if you are a middle-aged person and you feel that, as you're eating, food is sticking in the lower part of your chest, that is a very concerning symptom. And a lot of the time, patients like that have either a muscular problem of the esophagus or even esophageal cancer. So that symptom needs to be investigated thoroughly, and your gastroenterologist is the right person to do it. So the first person is to actually go to your PCP, and the PCP, when they see that you have a specific symptom like this related to the esophagus, they know where to send you.
Okay.
And it is to go to a gastroenterologist and get a scope done. And if the gastroenterologist finds a diagnosis that needs to be seen by a specialist like myself, they usually set it up so that we see them quickly. Now, as far as lungs are concerned, in lungs, the symptomatology is very different. That is, the symptoms that a patient gets. It's cough, it's bringing up blood in your cough, it's tiredness that doesn't go away, chest pain, all these kind of things. And so that's kind of different from the esophagus. And that is treated by your PCP, referring you essentially to either directly to a clinic like somebody like me does in some areas of Tennessee, or to a pulmonologist, who is a lung doctor, who's a medical lung doctor, who's able to do the scopes just like the gastroenterologist does for your esophagus.
Good to know. On that note, we are going to take a quick break. More of your phone calls when we come back. Stay with us.